A mysterious virus outbreak in Russia has raised alarms as reports detail severe symptoms among affected individuals, including high fever, body aches, persistent coughing, and even coughing up blood. The initial report surfaced on the Telegram channel Shot on March 29, highlighting cases across various Russian cities. Patients tested negative for both COVID-19 and influenza, leaving medical professionals puzzled. Some doctors have diagnosed the illness as an acute upper respiratory tract infection of unspecified origin. In response, Russia's public health agency, Rospotrebnadzor, assured that there is no evidence of a new or unidentified virus circulating. In response, Russia's public health agency, Rospotrebnadzor, assured that there is no evidence of a new or unidentified virus circulating. They attribute the cases to common respiratory infections, such as Mycoplasma pneumonia, and emphasize that the epidemiological situation remains stable. This outbreak has triggered fears reminiscent of previous pandemics, notably the 2023 Chinese pneumonia outbreak linked to Mycoplasma pneumonia infections. Adding to the concern, Russia's healthcare infrastructure faces strain, with reports of at least 160 hospital closures due to resource reallocation for military operations. Health authorities continue to monitor the situation closely, advising individuals with severe respiratory symptoms to seek medical attention promptly, while urging the public to follow preventive measures to curb the spread of respiratory infections.